All right. Hey, everybody. Welcome to season 9 of The Regimen, where pharmacy students and public health pharmacists learn about public health and all the policy issues within that. But this is a special series of The Regimen, which is the regimen on student recruitment, where we feature current and former students talking about why they chose URI, what were the advantages here, what were their best memories, and why they would do it all over again. So because it's season 9, it must mean it's time that we have a new student. I'll have Jiwoo introduce herself.
Hi guys. I'm Ji Woo. I go by G. I am originally from Canada, Vancouver, and right now I reside in New York City. Moved like 3 years ago, and I currently go to URI College of Pharmacy, a P4 with Dr. Bradberg, the one and only. And yeah. So Aneesha, welcome back. Season 1 host, right? Of course. Go
Aneesha
ahead.
started it all, but why don't you tell us what you're doing now and how you got there?
Sure. So currently I am a PGY2 and I'm doing my PGY2 residency in MedU Safety and Policy. So I went to URI's College of Pharmacy for 6 years. Then I did a PGY1 at Capital Health in Trenton, New Jersey. And now I am on to my PGY2, which is through Robert Wood Johnson in New Brunswick, New Jersey.
All right. And I'm super excited that Aneesha took time out of her very busy residency schedule to join us. We had always been talking since January 2022, I think. It's when we first started the regimen. And here she is back as our featured guest to talk about why she chose URI with G&I, as the regimen has grown beyond our wildest imaginations, born out of pandemic isolation and Zooms, and here we are able to connect. So let's start off. So Aneesha, sounds like you've had quite a successful last couple of years, and why don't you start with, for the folks listening who are considering choosing URI College of Pharmacy, why did you choose URI, or what was going through your mind when you were making those decisions?
Sure. I visited every Northeastern College of Pharmacy before I chose URI. And when I got to URI and I toured the campus, it was pouring that day. But I still, for some reason, just felt like I fit in already the day that I got there. And I thought, I think this is the place for me just because of the environment. Everyone that I spoke to at the College of Pharmacy was so welcoming and inviting. And I got to also see the success of past students that were there prior. So I just felt like it was the right fit for me, just based on how I was feeling at that time. And then I decided to go to URI based on that one visit. And I don't regret picking it at all to this
All
day.
right. So you would do it all again after all of your experiences if you had to choose?
Yes, absolutely. I would do it all over again.
So what was your like, so then you made that choice, pouring rain, you said you felt like you fit in. We're a 0-6 school, so you had your 2 years. What were some of the things that you did early in your college career, either in the pharmacy program or outside pharmacy? I know you were involved in several organizations and things on campus.
Yeah, so I was very lucky because the dorm that I lived in had all pharmacy students on my floor. So I got to meet everyone that I was going to be in school with for the next 6 years. But I also decided to put myself out there more and I joined Greek Life, which I thought was really helpful for me because I got a balance of being friends with pharmacy students and non-pharmacy students, which I think is important, because you want to be surrounded by a diverse group of individuals. So I did that. And then going in closer to my professional years of pharmacy, I joined professional pharmacy organizations so I could become more involved with like public health, volunteering, things like that. So I joined SSHP and I joined SNAFA, and I was pretty involved with both of those organizations. And yeah, that's pretty much what I did throughout school, like extracurricularly. And I also worked at the same time as a pharmacy technician. So that was really important for me too to start building my career. And URI really encouraged that, like helping you build your career and kind of starting your resume from the beginning, very early on. So I thought that was also very helpful.
Like being involved in so many different organizations, how do you feel like it really helped you grow as like a person, and how did it help you become like the pharmacist you are now?
So I think it helped me in a few aspects. One was networking, right? I got to meet like all these different kinds of people. I got to become closer with professors like Dr. Bratberg, who later wrote me a letter of recommendation. And I also just like built relationships with people in the community. And I think that as inherently as a healthcare worker, like that's what you do. And URI, like with all the organizations that they have, they really like not pushed us to do it, but encouraged us. And I think that that was really helpful. So I think just within networking, helping out, being involved with my peers, just kind of I grew into the practitioner that I am right now.
So one of the things that makes our curriculum, I think, different than other schools is the ability to take electives. We
Mhm.
don't really have tracks for things. So do you want to talk a little bit about, the electives that you found? I know you took my elective, but you want to talk about, why you chose them or how they helped you in what you're doing today?
Yeah, so before I took your elective, I actually took the pharmacy leadership elective. And that was one of my favorite classes throughout pharmacy school. And now I'm doing a PGY2 in med use safety and policy. And I think that ties right back into where I started with that leadership class earlier. And like, URI is a very clinical school. And I think that that's one of their really big strengths. But I think some people like forget that we have the leadership opportunities too. And I always thought I wanted to go into it like specific clinical fields, but I think that class is where I was like, I don't think that's what I want to do. I think I want to be somewhere, on the administrative side of things or maybe academia. And Dean Larrett, he got to spend some time in DC and do policy work and things like that. And he really inspired me in that aspect. So I think the pharmacy leadership class was amazing. And then I got to take your immunization public health S class, and you know that I love public health and it's one of my favorite things still. And that, kind of helped me figure out like what I'm passionate about. And we did so much work with like syringes and like needles and naloxone and all that kind of stuff. So I think that URI really offers like a wide range of classes that you can explore like your passions outside of that clinical realm of, like infectious disease and oncology and all those other things.
What would you say to that, G? Would you say that you've had a similar experience as up to this point as a P4 student?
Um, Yes, and also I feel like coming into pharmacy school, I was kind of lost as to where am I going to go after I graduate? What am I going to specialize in? Where do I stand? But I think what really helped me was that although I didn't know myself where I was headed, I think the faculty members here especially were like so adamant on figuring it out and helping you out. Or personally for me, they were just like, oh, there's this option, like emergency medicine is a thing, like what about this, like what are you, like tell me about you as a person. And then that from there they really kind of walked me through the process of figuring out what would work for me. And I think that really helped me understand myself on a personal level, but also kind of understand pharmacy in a broad spectrum, being like, okay, so I do have a lot of options, and these faculty members really do care about the students, is kind of what I was able to see.
It's interesting. I just realized something as you were talking, G, is that you and Aneesha have something in common, and that you both reached out to me in the fall before your P4 year and said, I need to take your rotation. What do I need to do to that effect? Which is, I mean, I'm that's flattering to do that. I teach an elective rotation that Aneesha was on, and we started the regimen to share more about public health and pharmacy's intersection. And G was very interested in this, and academia and all these other things that, what do? We start out in the morning, and sometimes we do what we set out to do, and sometimes we do entirely different things. She wrote a grant, submitted a grant this week in her first week of her rotation. So to study how to increase HPV vaccination. So still doing the same kinds of things. Aneesha was a co-author on this commentary on the harms of criminalization of drugs and how we're advocating for decriminalization. And so I'm not the only faculty member who's working with students who want to work with faculty. And I think I'm encouraged to hear and want the audience to hear that we really do want to work with students. And that's why we do what we do. And students have this great relationship with us to say, like, let's just get things done, help your career, help URI. What have you, Aneesha, have you worked with APPE students? I know you've done APPEs and residency, you've worked with students from other schools. How would you compare what you've learned at URI to the folks that you've worked with on APPEs, if you can comment on that?
Sure. I think what I will say is that URI compared to other schools really does mold like young students and APPE students into really good clinicians later on. Like, I'm talking from a clinical perspective. I think our clinical, like our teaching and our curriculum is extremely strong. Just from what I have experienced with URI students with myself and comparing to all the other schools. But that's something that I have noticed, and I think that's a really good thing, because at the end of the day, you are a clinician and you're coming out as a pharmacist, and regardless of what you do with it, at least you have a solid knowledge base and you're ready to go in whatever field that you are going to pursue. So that's something that I've noticed that was interesting.
And your class, I think there's a lot of folks. We've had really successful years with matching. And again, anybody who's interested in URI will see our rate of residency attainment and fellowship attainment and things like that. You're in an area where lots of your colleagues are doing fellowships or are probably still there.
Yeah.
Do you stay in touch with your colleagues even through residency and things like that? Is that an easy thing to do?
Yes, it is. If you make an effort, it is. And I will tell you that when you come to my wedding, you will be seeing a lot of the kids that I graduated with.
All right, no pictures. It'll be great.
No pictures. Yeah. So I do stay in touch with them. It is hard because everyone's busy. We're all like staffing and working at night, but these are the same kids that I'm referring to from freshman year when I lived on the same floor as them. I'm still talking to those same people now, texting them, calling. Some of them live in Idaho and some of them live in Connecticut and Rhode Island, and I still talk to them. So
that's great.
I think URI helped me like build those relationships and keep those relationships too, because we are a smaller pharmacy school. I mean, relatively smaller, right, to other schools, but that's a good thing.
And G and I were just talking about that. Did you want to follow up on that, G, about like staying in touch with friends now that you're on rotation, you're not seeing them every day in the building? You want to comment on that?
Yeah, I feel like being in pharmacy school, you kind of cry together with your friends. And you also kind of like go through a lot of things with your friends, really help each other out. And because we are a relatively smaller school, it's really easy to see like other people help each other out all the time. And everyone has this like understanding that we're all going to end up in the same place once we graduate. Like we have the same exact goal of graduating together. So everyone's very open to helping each other out. And the professors, their doors are always open, whether or not you guys already know each other or not. Like, it doesn't really matter. You can go into a random professor's like office and be like, hey, like, I'm so and so, can we please have this conversation? I'm lost. They're always welcome to do that. And with like upperclassmen too, you make these like amazing connections with upperclassmen and lowerclassmen. So you kind of like see all these different perspectives. If you need any like advice on residency or anything else that you're gonna experience in the future, they're always there for you. Even if they like are off in residency, like Aneesha, they're always available. They're always welcome to talk, which is amazing.
Absolutely. I remember when I took ID core P2 year, I was having trouble with like understanding which drugs cover gram negative, gram positive. And I went to Dr. LaPlante's office and she sat with me for like more than an hour and made this like ginormous chart and just like wrote plus signs and minus signs like all over it to help me understand like what was actually going on. And then I got like a 98 on her exam and I was like, well, makes sense.
All right, sounds great. So we've got organizations, you've got long-term social connections, you've got, I mean, we probably should say we're right next to the beach. So I mean, that's always a good thing versus other
Always
places.
plus. Yes.
You have professional and professional leadership opportunities in our electives and our appies. And again, we have a very well-established program. And I think, not only do you have your connections with your colleagues or your peers or your classmates after you graduate, but I think, I'm in touch with many of the students who, and we're going to see them on these series too, from the regimen and, what's happening with my career and can we, looking for career opportunities and advice. And so that's the greatest part of my job is to say, okay, well, hey, Aneesha, go get that PGY too, right? And you applied for one and got one, and here you are. I'm very proud
It's
of what you've
crazy.
done. So it's kind of
Thank
cool to
you.
keep in touch. And now I'm going to your wedding. So the second or
I
third.
know. You know what though? I don't think I would be where I am today without the support from all the faculty at URI because you know what I went through when I didn't match the first time around, and that was really, really difficult. But I remember I texted you, I didn't match, and you texted me immediately back, and you were like, "What can I do?" And then I had a meeting with Dr. Ward, who runs the URI DI Center. She sat down with me and said, what can I do? And we came up with a plan. And then I got like 6 interviews and I matched. And it was just, I don't know what happened, but without all that support and help, I don't think I would be where I am today.
Okay, so that is it for today's regimen. I would like to thank Aneesha for being here today to talk about her experience at the University of Rhode Island College of Pharmacy. We hope you enjoyed our conversation and found it both informative and entertaining. If you enjoyed today's episode, please take a moment to subscribe, rate, and review us on your favorite podcast platform. Your feedback helps us reach more listeners and continue to produce great content. Again, thank you for listening, and we cannot wait to have you back with us on the next episode of The Regimen.